So, imagine trying to drive a car forward by just like slamming your foot on the gas, only to realize that your body has secretly pulled the parking brake.
Right. Yeah.
You know, you're putting in all this effort, you're exhausted, but instead of actually moving forward, your internal systems are they're just grinding against each other, completely locked up.
It's a very visceral analogy.
Yeah, and for anyone listening to this who has ever felt fundamentally disconnected from their own body, especially if you've dealt with unexplained pelvic pain or tension or, these chronic issues that remain totally invisible to the outside world, that parking brake scenario is probably hitting very close to home.
It really is. And
Yeah.
it is an incredibly isolating experience for patients, primarily because the dysfunction is happening on a neurological level that, well, neither they nor their doctors can just simply look at and diagnose with the naked eye.
Which is exactly why our mission for this session is so fascinating. We are unpacking a highly specific, cutting-edge stack of sources, medical guidelines, physical therapy manuals, clinical studies.
The whole stack, yeah.
Right. And we're looking at how specialists use the visual indicators on automated biofeedback machines to actually cure a condition known as uncoordinated pelvic guarding.
Right.
We're talking about technology that literally provides like a mirror for your muscles, making the invisible totally visible.
Exactly.
So, okay, let's unpack this, because before we can grasp how this machine works its magic, we really need to understand the physiological trap people are stuck in. I mean, why are these specific muscles so notoriously difficult to control?
Well, we really have to look at a mechanism called dyssynergia, which, very often presents clinically as pelvic guarding. In a normal, healthy body, your pelvic floor muscles operate as this highly coordinated, dynamic team.
Right.
They maintain a baseline resting tone to support your organs and maintain continence, but they absolutely must be able to fully and completely relax during biological functions like bowel movements or penetration.
Squeeze to hold things in, let go completely to let things pass or enter.
Exactly. But with dyssynergia, that coordination is just entirely shattered.
Yeah.
The muscles do the exact opposite of what the brain is actually asking them to do.
Wait, the opposite.
Yeah. So instead of yielding and relaxing during a bowel movement, the pelvic floor contracts and spasms. It's a paradoxical contraction. The body is essentially fighting its own biological imperative.
Oh, wow. That sounds awful.
It is. And the downstream effects of this are severe. I mean, we see patients dealing with chronic, intractable constipation, this constant agonizing sensation of incomplete emptying and just severe pelvic pain.
Right, because the muscles are just locked up.
Yes. And it's also a primary driver of conditions like vaginismus, where these reflexive involuntary spasms make penetration not just difficult, but, incredibly painful or practically impossible.
So you're trying to perform a totally natural human function, and your nervous system just throws up a brick wall.
That's exactly what it feels like.
And what's so tragic reading through these physical therapy sources is seeing how often people try to fix this on their own, or even like with a well-meaning doctor, and it just makes things worse.
Oh, absolutely. The failure rate for standard verbal instruction is actually staggering.
Mm.
There is a study in our material from a researcher named Bo, published in 2013, that highlights what we call the 70-30 rule.
The 70-30.
Right.
Yeah.
So the research showed that 70% of women with pelvic floor dysfunction cannot correctly contract or relax their muscles based on verbal instructions alone.
70%. That is wild.
Right. If a clinician tells them, squeeze here or release this muscle 7 out of 10 times, the patient's brain simply cannot translate that auditory instruction into the correct physical action.
So the communication line between the brain and the pelvis is it's just dead.
It really is. And the remaining part of that statistic is, it's actually even more concerning. 30% of those individuals actually cause more harm to themselves when they try to follow those instructions.
Wait, how do they cause harm?
Well, when they're told to contract and lift the pelvic floor, they can't find the muscle, so they compensate. They perform what's called a Valsalva maneuver.
Oh, I've heard of that. That's like bearing down, right?
Exactly. They bear down, utilizing their abdominal muscles to push downward, which violently increases intra-abdominal pressure. And if you are trying to rehabilitate a distressed or dysfunctional pelvic floor, bearing down is the absolute last thing you want to do.
Because it just adds more pressure to an already stressed system.
Right. It reinforces the dysfunction and puts immense strain on already vulnerable tissues.
So, okay, if I want to flex my bicep, I just flex it. The brain sends the signal, the arm moves. Why is the brain so uniquely terrible at talking to this specific group of muscles in the pelvis.
The core issue there is a massive deficit in proprioception.
Proprioception.
Yeah, proprioception is basically your body's internal GPS.
Yeah.
It is the ability to sense movement, action, and location without having to look. It's the reason you can touch your nose with your eyes closed.
Right. You just know where your hand is.
It's exactly. However, the Cleveland Clinic guidelines we reviewed explain that when muscles are in a state of chronic, constant tension and spasm, which is the literal definition of pelvic guarding, they give off incredibly limited proprioceptive sensations.
So the map gets completely wiped out.
The map is gone. The sensory neurons essentially get flooded by that constant low-level spasm. It creates all this neurological noise.
Oh, I see.
Yeah, and to protect itself from sensory overload, the brain just tunes that noise out. It effectively mutes the signal from the pelvic floor. The brain can literally no longer feel what the muscle is doing.
That is terrifying.
It is. But the brain is a problem-solving organ, right? If it still needs to stabilize the core or control continence, it starts recruiting other muscles to do the job.
Like compensating.
Exactly. The patient unknowingly clenches their jaw, or their abdominals, or their glutes. And this creates a vicious cycle where the brain receives faulty feedback, cementing the wrong movement pattern, while the actual pelvic floor just remains locked in a silent spasm.
Wow. Okay, so if the internal map is gone and you can't feel the muscle at all and verbal instructions fail 70% of the time, how on earth do you begin to treat this? I mean, you clearly can't just talk a patient through it.
No, you can't. You have to bypass that broken internal sensation entirely. And this is the precise reason biofeedback is required for treatment.
Okay, is this where the machines come in?
Yes, if the brain cannot feel the muscle from the inside, you have to create an external visual loop to reteach the brain where the muscle is, what it is doing, and how to control it.
Let's talk about that external loop because the actual clinical setup for these automated biofeedback machines it's fascinating and it's totally painless. You are in a clinical setting, usually with a specialized physical therapist, sitting in a comfortable position, fully clothed or draped, and they hook you up to a computer using sensors.
Right, the sensors are the critical interface here. Clinicians use external skin patches placed near the perianal area or internal vaginal or rectal probes, and that depends entirely on the patient's comfort level and the specific diagnostic need.
Makes sense.
But we do need to make a very clear distinction about what these sensors are actually measuring. There is a world of difference between the older pressure-based devices and modern EMG-based devices.
Yeah, because a pressure device like a manometer just measures physical force. It's basically a scale. You squeeze it, and it tells you how much physical pressure you applied, which, that might be useful if you're just trying to build raw strength.
Right.
But for pelvic guarding, hypertonicity, and spasms, specialists need to see the nervous system at work. They rely on surface electromyography, or SEMG, and here's where it gets really interesting.
It really does, because surface electromyography bypasses the physical squeeze and looks directly at the neurology.
It's literally reading your nerves.
Yes. Whenever your brain tells a muscle to contract, motor neurons fire a neurotransmitter called acetylcholine, which changes the electrical charge of the muscle fiber. This electrical action potential propagates through the tissue right to the skin.
And the sensor just picks that up.
Exactly. The SEMG sensor is highly sensitive. It sits there and listens for that exact electrical voltage. It is measuring the neurological command to contract, not the physical force of the muscle itself.
Which is why I love calling the SEMG machine a real-time lie detector for your muscles.
It absolutely functions that way, and honestly, it can be quite a shock for the patient.
I can imagine. A patient dealing with severe chronic pelvic pain will be lying on the treatment table, and they will swear to their physical therapist that their muscles are completely relaxed. They genuinely feel relaxed.
Because the proprioception is gone.
Right. But the therapist points to the monitor, and the SEMG graph is just spiking wildly, picking up constant, high-level electrical signals. The screen provides undeniable proof that the muscles are actively clenching and guarding, even when the patient's conscious brain is completely unaware of it.
And what's fascinating here is that this is where we see the profound power of neuroplasticity driven by operant conditioning.
Operant conditioning.
Right. By providing that visual stimulus, the spiking graph on the screen, the clinician gives the patient a tangible way to interact with what is essentially an involuntary autonomic response. Operant conditioning is a method of learning based on trial, error, and immediate reward.
So you're looking at the screen, you see the line is high, which means you are clenching. You adjust your breathing, you consciously try to let go, and instantly the line on the screen drops. Your brain gets that hit of dopamine, it gets the visual reward.
Yes. And that instant visual reward is what physically builds new neural pathways. The brain starts associating the new theatrical sensation, even if it's very faint at first, with the visual success on the screen.
It connects the dots.
Exactly. The machine proves to the patient that their perceived baseline of relaxed is actually a state of chronic spasm. And once they can visually see the spasm, they can begin the grueling neurological work of turning it off.
Well, let's get into how they actually turn it off. Because when people hear pelvic floor therapy, their minds almost immediately jump to Kegels.
Oh, usually, yes.
Right, they think about squeezing, lifting, and strengthening. But treating this condition requires the exact opposite.
Completely the opposite. Subjecting a guarding hypertonic pelvic floor to strengthening exercises like Kegels is incredibly dangerous.
Dangerous.
Very. If a muscle is already locked in a painful, exhausted spasm, forcing it to contract harder will only exacerbate the pain and further shorten the muscle fibers. Uncoordinated guarding requires a completely different therapeutic approach known as down training.
Down training. So instead of pulling up and in, specialists teach patients techniques like diaphragmatic breathing and pelvic bulging.
Mhm.
You are instructed to use the mechanics of a deep inhale to gently expand and drop the pelvic floor.
Right.
And while you are doing this, you are laser focused on that computer screen. You are hunting for a corresponding drop in the resting muscle tone on the graph.
Because the goal of down training is to find the true basement of muscle activity. I mean, many of these individuals have been operating with their pelvic floor engaged at 40 or 50% capacity all day long for years.
Just constantly clenched.
Exactly. Down training visually guides them back down to zero. And the visual interfaces designed to facilitate this have become incredibly sophisticated.
Yeah, we aren't just looking at generic clinical line graphs anymore. The sources detail some highly specific visual interfaces designed just for this purpose.
The Neuraxum biofeedback system is a prime example of this. They utilize an interface called circle view.
Circle view.
Yes. So instead of a line graph, muscle activation is represented as a circle that squeezes and expands on the screen. And the clinical benefit here is that it provides crucial temporal context.
Temporal meaning like the timing of the contraction.
Correct. It visually demonstrates not just the intensity of the muscle firing, but the exact moment it fires. For uncoordinated guarding, timing is everything.
Because it's dyssynergy, it's firing at the wrong time.
Exactly. A patient needs to know that the muscle is releasing at the precise millisecond they initiate an inhale. The visual of the circle expanding helps the brain synchronize the physical movement with the correct timing of the neurological signal.
That makes total sense. And our sources also cover patient-facing home devices that take these visual cues even further. Like the LV trainer uses an interface with a pale green gem on a smartphone screen that moves in response to your pelvic floor.
Yes, the home trainers are a huge advancement.
But what caught my eye was a specific safety feature designed to combat that 70-30 rule we discussed earlier.
The Valsalva alert.
Yes.
It's brilliant. It uses its internal sensors to detect the direction of force. So if a user gets confused and begins dangerously bearing down instead of lifting or relaxing, the app immediately flags the error on the screen.
Which is so important if you aren't in the clinic.
Right. This prevents the patient from mindlessly repeating and reinforcing those harmful movement patterns when they are training at home without a therapist present.
But wait, hold on. I do need to ask you about the gamification aspect of this, specifically systems like Kegel or Pelvify.
Okay, sure.
I mean, I understand the clinical bar graphs, and the squeezing circle makes total sense. But the sources show that these apps use actual video game interfaces. You're doing your down training, but on your phone screen, you are controlling a butterfly trying to collect flowers, or like flying a rocket through a galactic star tunnel.
Yes, they do.
There's even an animated octopus character that guides you through your therapy. And I have to push back here. We are talking about severe, life-altering chronic pain here. Doesn't having patients play a smartphone game with a cartoon octopus completely trivialize what they're going through?
I completely understand why it seems trivial on the surface. But if we connect this to the bigger picture of the psychological reality of neuromuscular rehabilitation, these games are an absolute necessity.
A necessity.
Yes. Down training is incredibly tedious, emotionally taxing, and intensely frustrating. You are asking a patient who is already in pain to sit quietly in a room and try to relax a muscle they literally cannot feel, day after day, week after week.
Yeah, sitting alone with your pain and a graph that won't move does sound like a recipe for just giving up.
Exactly. The dropout rates for ungamified therapy can be incredibly high. Gamification is not a toy. It is a highly sophisticated, clinically designed compliance tool.
Okay, I see.
It disguises complex endurance training as gameplay. To successfully navigate that rocket through the star tunnel without hitting the walls, the patient is required to hold a very specific, low-level maximum voluntary contraction, or perhaps maintain a complete flatline relaxation for 3 solid minutes.
Wow, 3 minutes of perfect control.
Right. The game mechanics demand intense neurological precision, and it distracts the anxious brain, providing a sense of play and achievement, which prevents patient burnout over the prolonged period it takes to achieve permanent physiological change.
Which brings up the timeline, because rewiring your nervous system isn't something that just happens in an afternoon.
No. Building new neural pathways through operant conditioning is a biological process that takes time. The clinical guidelines indicate that it typically takes 6 to 12 weeks of consistent visual biofeedback training for the brain to establish meaningful new connections to the pelvic floor.
6 to 12 weeks.
Yes, with maximum therapeutic benefit usually occurring around the 12 to 16-week mark.
So after those 12 weeks of watching rockets and octopuses, does this actually work in the real world? Like, does looking at a screen actually cure physical pain?
The clinical evidence is overwhelmingly positive. We can look at the landmark McKay study from 2001 that was included in our sources. They conducted a trial focused on 29 women diagnosed with moderate to severe vulvar vestibulitis syndrome.
And just for context for you listening, vulvar vestibulitis involves extreme introital tenderness, meaning severe burning pain right at the opening of the vagina. It makes penetration, whether that's using a tampon, undergoing a pelvic exam, or having sex, agonizing or physically impossible.
It is a profoundly distressing condition that takes a massive psychological toll. So in this study, the women were given computerized EMG assessments to map their dysfunction and then provided with portable EMG home trainer biofeedback devices.
Right.
They practiced their down training using visual feedback and had monthly clinical evaluations.
The results after they completed the treatment with these devices are absolutely staggering. Following the biofeedback protocol, 88.9% of the women reported their pain was reduced to negligible or mild.
It's incredible. Nearly 90% of participants essentially eliminated their severe chronic pain.
And even more life-changing, 69% of those women were able to resume completely painless sexual activity.
It is a true paradigm shift for those patients. They got their lives and their autonomy back.
Truly.
However, the Cleveland Clinic guidelines are careful to note that while visual biofeedback is the primary tool for neurological rewiring, it is often most effective when paired with manual release techniques.
Right, the hands-on physical therapy aspect?
Yes. When a muscle has been locked in a chronic spasm for years, the muscle fibers themselves physically shorten, and the fascia, the web of connective tissue wrapping around and supporting those muscles, becomes tight and rigid.
So the hardware is messed up too, not just the software.
Exactly. While the biofeedback machine successfully rewires the brain's software to stop sending the spasm signal, the physical therapist still needs to address the hardware. They use manual release with their hands or specialized dilators to stretch that shortened tissue and restore normal physical mobility to the fascia.
So what does this all mean? When you step back and look at this entire deep dive, the takeaway is just incredibly empowering. For anyone out there who feels like their body has betrayed them, who is dealing with mysterious, invisible pelvic pain that doctors have brushed off or failed to fix, it is so vital to know that this pain is often not a permanent life sentence.
It really isn't.
In so many cases, it is quite literally a software glitch in your body's nervous system. And with the right technology, that glitch can be visually debugged.
Knowledge, when applied, is power. By taking these autonomic, invisible, and terrifying spasms and translating them into tangible visual data on a screen, we completely demystify the pain. We make the invisible visible.
I love that.
And in doing so, patients reclaim autonomy over their own bodies. They stop being victims of a rogue neurological signal and become active, empowered participants in their own healing process.
It really is a remarkable journey we've taken today. You know, we've explored the frustrating physiological trap of pelvic dyssynergia, where your body fights itself and the brain loses its internal map.
Right.
We've seen how the SEMG acts as a lie detector to bypass those broken sensations, reading the actual electrical signals of the nervous system. We've unpacked how gamified visual interfaces, from squeezing circles to animated octopuses, use operant conditioning to rewire the brain and prevent patient burnout. And ultimately, we've seen the hard clinical proof that this technology is actively curing chronic pain.
It perfectly illustrates how targeted technology can facilitate profound human healing.
It really does. And as we wrap up today, I want to leave you with one final mind-expanding idea drawn from the RUSI position statement in our stack of sources. We spent this entire session talking about how visual biofeedback is wildly successful for rehabilitating muscle spasms after years of trauma, pain, or dysfunction.
Yes, after the fact.
But researchers are already looking at the future. Emerging studies are exploring the use of ultrasound imaging, or USI, to provide real-time visual biofeedback of pelvic floor relaxation during active labor.
Bringing this technology into the delivery room is truly the next frontier.
Imagine a near future where a person giving birth isn't just relying on internal sensation or coaches yelling to push. Instead, they can look at a screen in real time and use visual biofeedback to perfectly coordinate their pelvic muscles.
It would be revolutionary.
They could actively watch themselves relaxing the pelvic floor as the uterus contracts, potentially preventing paradoxical contractions, avoiding prolonged labor, and stopping severe childbirth injuries before they even have a chance to happen. It is the ultimate mirror for your muscles, utilized not just for healing trauma, but for preventing it entirely. Thank you for joining us on this deep dive. Keep asking questions, keep looking for those invisible connections, and keep exploring the amazing technology within your own body.